kidney disease, often dubbed the silent killer, is a stealthy and potentially fatal condition that affects millions worldwide, quietly damaging your body long before symptoms appear, and by the time they're noticeable, significant harm has often already been done, making early detection and awareness vital. The kidneys, two bin-shaped organs located just below your rib cage on either side of your spine, play a critical role in maintaining homeostasis by filtering waste products, excess fluids, and toxins from the blood, regulating blood pressure, balancing electrolytes, and stimulating red blood cell production via the hormone erythropoietin. So when kidney function begins to deteriorate, whether due to acute injury or chronic progression, every system in the body can feel the impact. And yet chronic kidney disease, CKD, often progresses unnoticed through 5 stages, beginning with mild damage in stage 1, to complete kidney failure or end-stage renal disease, ESRD, in stage 5, a point at which dialysis or a kidney transplant becomes necessary for survival. And while CKD can affect people of all ages, it is most commonly linked with diabetes and high blood pressure, two leading causes accounting for nearly 2/3 of all CKD cases globally, as high blood sugar from diabetes can damage the tiny blood vessels in the kidneys, impairing their filtering abilities, and uncontrolled hypertension increases the pressure in these vessels, slowly scarring them and reducing efficiency over time. However, other causes include glomerulonephritis, an inflammation of the filtering units, polycystic kidney disease, a genetic disorder causing fluid-filled cysts, recurrent urinary tract infections, prolonged use of certain medications such as NSAIDs or some antibiotics, heavy metal poisoning, and autoimmune disorders like lupus, all of which can impair kidney function directly or indirectly. Unfortunately, in the early stages of CKD, patients may exhibit no symptoms at all, which is why it's often dubbed a silent disease, but as it advances, common symptoms include fatigue, swelling in the ankles, feet, or face due to fluid retention, changes in urination such as frequency or color, persistent itching from waste buildup in the blood, muscle cramps, nausea, shortness of breath, high blood pressure that's hard to control, loss of appetite, trouble concentrating, and metallic taste in the mouth, all of which signal that waste is accumulating in the body due to reduced kidney efficiency. These symptoms often develop gradually, and because they overlap with many other conditions, they're frequently dismissed or misattributed, delaying diagnosis until significant damage has occurred, which is why regular screening is crucial for at-risk individuals, especially those with diabetes, hypertension, heart disease, a family history of kidney failure, or older age. Diagnosis typically begins with blood tests measuring creatinine and calculating the estimated glomerular filtration rate, EGFR, alongside urine tests for albumin, a protein that shouldn't be leaking into urine, imaging studies like ultrasounds to assess kidney size and structure, and sometimes kidney biopsies to determine the exact cause. Once diagnosed, treatment depends on the stage and underlying cause but always includes lifestyle modifications, medication management, and in severe cases, renal replacement therapy. Early-stage treatment focuses on slowing disease progression by controlling blood sugar levels through diet, exercise, and insulin or oral medications for diabetics, managing blood pressure ideally below 138 using ACE inhibitors or ARBs, both of which offer kidney protective benefits, reducing protein intake to ease the kidney's workload, avoiding nephrotoxic drugs and managing associated conditions like anemia and bone mineral disorders, which can arise due to disrupted hormone levels in later stages, particularly stage 4 or 5. Patients may be prepared for dialysis, either hemodialysis, which involves filtering the blood through a machine several times a week, or peritoneal dialysis, which uses the lining of the abdomen to remove waste products via a cleansing fluid. And while dialysis can prolong life and alleviate symptoms, it is not a cure and can significantly affect quality of life for eligible patients. Kidney transplantation offers the best long-term outcome, with the potential to restore near-normal kidney function and eliminate the need for dialysis, though it comes with risks such as organ rejection, side effects from immunosuppressive medications, and the ongoing challenge of finding a suitable donor. Aside from medical treatments, lifestyle changes play a monumental role in managing CKD, including adopting a kidney-friendly diet low in sodium, potassium, and phosphorus, staying hydrated without overloading fluid intake, quitting smoking which can accelerate kidney damage, maintaining a healthy weight, engaging in regular but moderate physical activity, and attending regular medical checkups to monitor kidney function and adjust treatment as needed. Mental health is also crucial, as many patients with CKD experience depression, anxiety, and stress, especially as the disease progresses, so psychological support, counseling, or group therapy can be essential components of comprehensive care. Prevention, of course, remains the most powerful strategy, and this starts with controlling risk factors early in life via keeping blood pressure and blood sugar within healthy ranges, avoiding excessive use of painkillers or illegal drugs, staying hydrated, and getting regular screenings, especially for those with risk factors or family history, as catching kidney damage early can slow or even halt progression, preserving kidney function for years. Globally, CKD is a growing concern, with over 850 million people affected worldwide and nearly 1 in 7 adults in the United States estimated to have some form of kidney disease, yet many remain undiagnosed due to lack of awareness, poor access to care, and the subtle nature of early symptoms in many low and middle-income countries. Lack of diagnostic resources and treatment access worsens outcomes, leading to a high number of preventable deaths, making public education campaigns, healthcare investment, and community outreach programs essential for reducing the global burden. Initiatives like World Kidney Day, observed annually in March, aim to raise awareness about the importance of kidney health and promote early detection and treatment strategies, while organizations such as the National Kidney Foundation and the International Society of Nephrology provide educational materials, research funding, and patient advocacy. Technology is also playing a growing role, with wearable devices and AI-driven platforms helping patients and doctors monitor blood pressure, glucose levels, and other risk indicators more closely, allowing for more personalized care plans and earlier intervention. Despite these advances, however, the fight against kidney disease ultimately begins with personal responsibility. Being informed, proactive, and vigilant about your health, especially if you fall within a high-risk group, and by recognizing that your kidneys, though small and often overlooked, perform essential life-sustaining functions every second of every day, you can take steps to protect them before irreversible damage occurs. Whether through adopting healthier habits, attending regular checkups, or simply staying informed, you have the power to reduce your risk and detect kidney disease early, turning a silent killer into a preventable threat and giving your body the long-term care it deserves. Because when it comes to kidney health, what you don't know truly can hurt you, and the time to act is now.